Colleran joins us today with CHI St. Vincent Heart Clinic Arkansas, and we're going to talk about the causes, the symptoms, the treatments for heart failure. And we hear this a lot, Dr. Colleran.
Yes.
We hear heart failure, congestive heart failure, same thing basically?
Yes, it is.
Okay,
Yes.
kind of explain what it is for us.
There's many causes for congestive heart failure. One of the main causes is coronary artery disease or previous myocardial infarction. Hypertension also is a big cause of heart failure. The heart becomes stiff, it doesn't work properly, it's not beating efficiently, and then it begins to dilate and expand, and the heart becomes weak. Valvular heart disease also is a major cause for heart failure. Things like infections can cause heart failure, especially viruses, arrhythmias, irregular heart rhythms, and congenital heart disease can sometimes lead to heart failure.
Seems like it's like people who have had all kinds of different heart problems, and it leads to heart failure.
Yes,
at some
exactly.
point.
Yes,
Yeah.
yes. There's many causes for heart failure.
Can it be tied to things that are not related to cardiac disease?
Yeah, there's certain problems like abnormal protein deposits inside the heart, something we call amyloidosis. Anemia can lead to heart failure. If somebody's profoundly anemic, they can sometimes develop heart failure. People that have iron load issues because of multiple transfusions can sometimes have heart failure. People that drink too much alcohol or excessive drugs can sometimes lead to heart failure. So there's multiple reasons for heart failure. Thyroid abnormalities as well can cause the heart to become weak and lead to heart failure.
So it doesn't necessarily come after a specific heart problem.
No,
Yeah.
it's not necessarily because your heart itself has problems.
Right.
It could be other issues
Can be
in your
tied to
body.
other issues. So what are the symptoms we look for then when this is starting?
The main symptom is shortness of breath. People, when they're trying to exert themselves, they become profoundly short of breath. They have to stop. They can't walk as far. If they're lying flat in bed, they become short of breath and have to sit upright. They get swelling, edema in their legs and feet. Sometimes they'll get abdominal bloating. Sometimes they'll notice fast heart rates. And those are all sort of symptoms of heart failure. Those are things that key us into knowing that somebody may have heart failure.
Is it because the heart is not pumping correctly now
Yes,
for some reason?
it's not pumping efficiently.
Right.
It's not, in certain circumstances like high blood pressure, though, the heart becomes stiff and it can't dilate properly. And in other circumstances, which is the main cause of heart failure, the heart becomes large and dilated and weak.
Okay. Let's talk about how you can treat this.
Well, the mainstay of treatment is usually medication. And there's multiple medicines that we have. Diuretics are what we call fluid pills or fluid medication to get rid of the fluid in the system is very important. We have drugs called ACE inhibitors, most common being lisinopril, that is helpful in prolonging people's lives, as well as drugs called ARBs. There's drugs called beta blockers, metoprolol and carvedilol, that are very effective in treating heart failure. But also, when you have heart failure, you're going to have regular visits with your physician. You're going to have multiple testing done. Typically, we do something called an echocardiogram or an ultrasound of the heart. It may lead to a cardiac catheterization, and there's other things that need to be done.
Okay. Are there any things we can do before that? Are there lifestyle changes that we can do?
There's a lot of things people can do, and obviously your doctor or cardiologist will discuss this with you, but eating properly, like we'll find out today from the chef, low sodium diets, decreasing your fluid. If you're smoking, quit smoking. If you drink too much, you got to cut back on your drinking.
Or is there any surgery that can help, or are you just treating the symptoms?
Yeah, there's a lot of things that we can do. If you have coronary disease, bypass surgery would be something that would be considered, or stenting, or angioplasty. If people have abnormal heart rhythms, there'll be devices that will be placed in the heart. If you have valvular heart disease, you may have to have your valve repaired or even replaced. And then there's also something called a left ventricular assist device that would be helpful in improving heart failure. But that is something in somebody that's really in extreme circumstances.
Down the road.
Exactly. And the final thing that people may need is a heart transplant, actually.
Okay, well, we talk about so many of these different heart problems that you're
Right.
mentioning, but yet heart failure can kind of encompass all of those. So
Yes.
this is interesting and something that will affect a lot of people, I think, in their lifetime. Okay, let's put up the information then about CHI St. Vincent, of course, and Dr. Colleran there on Canis Road, and there's the phone number. If you need to call, if you recognize any of these symptoms or you just need more information or would like to set up an appointment, you can do that by calling them right there. Thank you.